You are listening to A Path to a New You, a podcast about mental health and veterans issues. I am your host, Timothy Zaromsky. I go by Tim. I am a therapist located in Madison, Wisconsin. I am a veteran. I served in the U.S. Navy from 2001 to 2009. You can find this podcast currently on Spotify and also Apple Podcasts. I just posted on Apple Podcasts a couple weeks ago, actually. So, yeah, there's the Spotify, and then there's Apple Podcasts. So anyone with an iPhone, you should have the Apple Podcast app, and you just look it up there. Look up A Path to New You, and you should be able to find it. I'm hoping to get it on other platforms sooner than later. Um, but yeah, it's been on Spotify for since I started, and then recently I posted it up on Apple Podcasts. I have a Facebook page called A Path to New You as well, where I post information on self care and other veteran and mental health issues on there as well. I'll also post a link to this podcast. So if you aren't able to find it on Spotify or Apple Podcasts, you can go to my Facebook page, A Path to New You, and I'll post a link there. And then there you can get all set up there. So please go to A Path to New You, a Facebook page. Please like it and follow. Um, like I mentioned, I am a therapist located in Madison, Wisconsin. New Beginnings Counseling LLC is my practice. I do have a Facebook page for that as well. If you go there and follow and like that Facebook page, I appreciate it as well. I do post self care stuff on there as well. This podcast is sponsored by New Beginnings Counseling LLC. It's veteran owned and a private practice. I currently see patients via Zoom, telehealth. Um, they do not have a wait list. So if you give them a call at 608 571 3896, you can actually set up an appointment. They do have openings available. It currently private pay as well. But if you can't afford what we charge, we will work with you. We specialize in anger management, PTSD, depression, anxiety, addiction. You can call or text the number 608 571 3896 for more information or if you want to schedule an appointment. Also, you can also contact us through the New Beginnings Counseling LLC Facebook page. You can message us there as well if you can't get a hold of us via um, the phone number. Again, the phone number is 608 571 3896 is the number. I try to do a podcast once a week. I think I did one a couple weeks ago. Again, stuff gets in the way, been busy. Um, and whatnot. But I try to do one at least once a week. The idea of this podcast is to spread information about mental health and also issues. I am a veteran, um, and like I said, I'm a therapist as well, and I like to educate people on those different topics. If you or someone you know is in the mental health field or is a veteran and you would think they'd be interested in being on the podcast, let them know about my podcast. Tell them to send me an email or send me a message through my Facebook page, A Path to New You, or you can have them text or call me at the 608 571 3896. And I definitely want to get more guests on this show. I do use Zoom for this, so I can send them a link so they wouldn't have to come to me or I don't have to go to them. I just use the Zoom link. I've used it before. This podcast actually used to be a radio show back in the day at the Sun Prairie Community Radio Station for about 2 years, and then work got in the way. I was doing it Fridays, and work got in the way where I was started working on Fridays. But now since I run my own private practice, Fridays are my days off where I can do self-care and whatnot. Anyway, today's episode, I wanted to talk about depression. There are there's different types of depression, and I want to talk about those as well as what is depression, as well as the effects, as well as treatment. What can you do to treat the depression? So anyway, like I said, today's episode is on depression. What exactly is depression? Depression, also known as major depressive disorder, or clinical depression, is a common but serious mood disorder. It can cause severe symptoms that affect how a person feels, thinks, and handles daily activities such as sleeping, eating, or working. To be diagnosed with depression, the symptoms have to be present for at least 2 weeks. I'll talk more about that in a different episode on how like to diagnose and whatnot. But yeah, usually for most diagnoses, most mental illnesses, you have to have these symptoms for at least 2 weeks. Again, that's another episode. I want to talk about how to diagnose and how therapists diagnose. All right. So yeah, they have to have the symptoms at least for 2 weeks. There are different types of depression, some of which develop due to specific circumstances. One of them is major depression, which includes symptoms of depressed mood or loss of interest, most of the time for at least 2 weeks, that interfere with daily activities. Persistent depressive disorder, also called the dysthymia, which is it's a new name for it on the DSM-5, consists of less severe symptoms of depression that last much longer, usually for at least 2 years. Then there is prenatal depression. It's depression that occurs during or after pregnancy. Depression that begins during pregnancy is prenatal depression, and depression that begins after the baby is born is postpartum depression. Seasonal affective disorder. That's another. You can say it's common, especially during the winter months when it's less light out. So that's also depression that comes and goes with the seasons, like I just mentioned, with symptoms typically starting in the late fall and early winter and going away during the spring and summer. So usually it starts between September, October, and goes until it starts getting light again, March, April. So once the days start getting shorter, that's when the seasonal affective disorder starts, and then when the days become longer, that tends to go away. So it's like I said, it's a seasonal affective disorder. Depression with symptoms of psychosis is a severe form of depression in which a person experiences psychosis symptoms such as delusions, disturbing false fixed beliefs, or hallucination, hearing or seeing things others do not hear or see. Also, people with bipolar disorder, formerly called manic depression or manic depressive illness, also experience depressive episodes during which they feel sad, indifferent, or hopeless, combined with a very low activity level. But a person with bipolar disorder also experiences manic or less severe hypomanic s- episodes or unusually elevated moods in which they might feel very happy, irritable, or up, quote unquote, up with a marked increase in activity level. So that's just some of the information about depression. Like I said, there's different types. I just went over a few of them. Didn't go really too much detail about them. Also, I want to talk about the main causes of depression. Again, I found this information throughout the web or throughout the DSM-5. DSM-5 is what I use to diagnose clients if they're already not diagnosed. So a lot of this information I find do a little bit of research. So, what are the four main causes of depression? Family history, being genetic. Depression is genetic. If your family has had depression, there's more likely that you'll also experience it. Illness and health issues. Physical illnesses or injuries can have a significant impact on your mental health. Chronic health issues, long term health issues, or physical health issues that drastically change your lifestyle can cause depression. Medications, drugs, and alcohol can cause depression as well. As you know, some of the medications, there's side effects can include depression. Many different medications can have an unfortunate side effect of depression, like I just mentioned. There could be a better alternative that your doctor could give you. Additionally, recreational drugs and alcohol use can also cause or worsen depression. While they may initially feel like they help your symptoms of depression, they'll make you feel worse eventually. That's why when I tell my clients or anybody I talk to who's really depressed, they're like, I'm gonna go drink. I'm like, I just kind of say, that might not be a good idea. You might feel a little bit better at the beginning, but eventually your depression might get worse. But a lot of them just do it, because their friends do it, so they're around their friends, which I can understand. Personality is the fourth one, which can cause depression. Personality, what I mean by that, perfectionists, those who like to be perfect, those who worry a lot or are stressed out a lot, who have low self esteem. So that's what I mean by personality. There's also additional causes of depression, such as life events, such as losing a job, stress at work, isolation, going through a breakup or divorce. Isolation is a big one. Um, we remember during the pandemic when everything was shut down and everybody's working from home, everybody's isolated at home. Depression rose during that time. So, isolation, going through a breakup or divorce, being diagnosed with an illness, being unemployed for a long time. Those are just a few. While negative life events can cause depression, they don't necessarily always cause it. Often it is more how you deal with those different situations. Feeling down most of the time can lead to depression. Again, you might be depressed, but again, it may not last for 2 weeks or 3 weeks. So technically, you're not diagnosed with depression. What behaviors can cause depression? Smoking, obesity, eating an unhealthy diet, lack of physical exercise, activity, are all behaviors that can cause depression according to many studies. Studies are done through different universities and whatnot. The risk of depression can also be due to risk factors varies with age. So the older you get, the more depressed you might be due to the fact that you're not eating healthy and you're smoking. I hope that makes sense. If not, again, you can reach out to me and ask questions via my Facebook page, A Path to a New You. Um, I can post this. Like I said, I'm going to post this link to this episode, and below that link, you can actually ask questions if you want, and I'll answer them. I want to get my those who listen. I want to get them more involved too. So if you have questions, please ask, and I'd like to talk more about this. I can do it one on one, or I can kind of do it on a podcast type thing where I answer questions after people ask them. What are five characteristics of depression? Appetite changes. A change in appetite is one common sign of depression. You may eat more or less than usual, and this change in eating pattern can affect your weight. So you can gain weight or lose weight depending if you eat more, if you eat less. Difficulty concentrating. You may have trouble concentrating if you are depressed. Lack of focus may interfere with your ability to perform at school or work. It may also make it harder to make decisions. Sleep changes is another one. Another common sign of depression is sleeping too much or too little. Um, so yeah, you could either have depression, you could either sleep too much or too little. Increased pain, unexplained aches and pains are a common feature of depression. Headaches, joint pain, bloating, digestive problems may be present if you are depressed. There's a few other things, characteristics of depression. Those are just the main ones. Um, so again, if you have any questions, please reach out to me via the Facebook page Path to a New You. I'd like to talk to you um and answer your questions. Another characteristic of depression is mood changes and irritability. That's another one. I was just trying to find the other one I was looking for. Anyway, mood changes and irritability may become more irritable, and your mood might change quite a bit. Slow for irritability. I can't speak right now. That may be something. The little things that might get to you, like you're irritable, like something that usually wouldn't really get to you does. Um, so that could also mean you're depressed too. So the last part of the episode I want to talk about how depression is treated. There's a few different ways depression is treated. I'm just going to talk about a couple of them, like the most common ones. The most common one would be psychotherapy. Psychotherapy. There are several types of psychotherapy. Also, is talk therapy or counseling. What I do, I counsel. I do talk therapy. Um, can help someone with depression by teaching them new ways of thinking and behaving, how to change habits that contribute to their depression. Evidence-based approaches to treat depression include cognitive behavioral therapy and interpersonal therapy. Cognitive behavioral therapy is one of the most common types of therapy. Again, I'll do another episode, a different episode about the different types of psychotherapies. Quite a few of them, and just so yeah, CBT for short, or kind of behavioral therapy, and interpersonal therapy yeah, are two common ones. Um, Also, a lot of the clinics now or private practices are doing they're doing in person and telehealth, like 50-50. I am currently right now doing all virtual right now until I'm not sure until when. Just noticed the COVID-19 cases are going back up, and so right now I am 100% virtual. I do have an office, so if you wanted to see me in person, we could make it work. Right now, all the those who I'm seeing right now, they all like doing the telehealth. The growth of telehealth for mental health services, which offers an alternative to in person, like I just mentioned, has made it easier and more convenient for people to access care in some cases. For those people who may be hesitant to look for mental health care in the past, telehealth services may be easier first step than traditional mental health services. There's also another common one is medications. medications such as antidepressants. There are medications commonly used to treat depression. They work by changing how the brain produces or uses certain chemicals involved in mood or stress. You may at first have to try up different types of antidepressants. That is when you work with if you have a psychiatrist or a primary care doctor, they're the ones who can prescribe you the medications. Us counselors who have master's degrees, we do not prescribe medications. We can refer you to someone, a psychiatrist, if you don't have one, or we can help you find one. Or again, you can use your primary care doctor. Your primary care doctor can prescribe medications too. Antidepressants, they don't work right away. They take between 4 to 8 weeks to work. What does that mean? That means you have to take them daily or as many. You have to follow the directions on the bottle. Says if it says take 2 times a day or once a day, you gotta take that, and you have to take that consistently. You can't miss doses for them to work, and they don't work right away. They'll eventually work, and it might take some time. That's where we come up with coping skills. As a therapist, we come up with coping skills to help you manage your depression until the medication works. I tell my patients, um, when they ask me, "Oh, I thought the medications work like they're the ones that's supposed to do the job." That is not correct. So it is you that needs to do it. The medication is probably about 30% of it. I guess I tell them 70% of it is you of how you eat. You know, you do your daily activities, you exercise, and the other 30% is the medication. So you have to work on it too. So it's not just the medications that just do all the work. You have to do it too. And that's where the therapists come in, where we talk about coping skills, ways to help you manage it. You know, so your medications will work as long as you do your part too. And like I mentioned, there's other different types of medications. You'd have to talk to your primary care or your psychiatrist to know more about the medications that work. I do suggest vitamin D. Vitamin D can be found in your local Walgreens or CVS, and it's usually over the counter you can get. So that definitely helps if you take those daily as well. But again, that won't do 100% of the work. You got to do the work as well. Again, talk to your primary care um, about the medications. There's also different things you can do as well. Talk to your primary care doctor about um, different medications. I guess I'm trying to say. Then during the seasonal affective disorder, there are these lamps that you can get online through Amazon, or I think you can also, um, I think your psychiatrist, your primary care can actually order you one as well. I think some insurances will cover it, but it's a light you use during the winter months, and you put it like in the corner where you sit, someplace you sit, and you turn it on and you sit down for about 10, 15 minutes in the morning and you read your book for, I'd say about 20, depending on 20, 30 minutes, and it helps with your mood. It's a different light. So I forgot what it's called. It's like a light lamp of some sort. It's not one of those you can buy at Walmart or anything. It's not one of those regular lamps. I forgot what it's called. But yeah, you can order one of those online too. Again, if you have any questions about anything I'm talking about, please reach out. You can message me through the Facebook page of Path to New You. You can message me there. There's a way you can message me. Again, when I post this link to this episode, if you have questions, or I'm sure you can comment underneath it. And if you have a question, please ask, and I can actually answer it right there on the when I reply to your question. I'm trying to get more trying to get people involved who are listening. Um, Again, if you are struggling with depression or looking for a therapist, um, I I do have openings available for my private practice. My number again is 608-571-3896. I am seeing people virtually via Zoom. So, anyway, I hope you learned a little bit something about depression, treatment, and um, and the characteristics and effects of depression in this episode. Again, if you know someone who would like to be on this podcast, who's either a veteran or someone who works in the mental health field who has a some sort of specialty, please have them reach out to me um, via my Facebook page. Again, it's Path to New You. You can look it up. You can click on it, like it, and follow, or you can contact me via my phone number. It's 608-571-3896. You can text that number as well. And again, I use Zoom for my guests on this podcast. So I can just send them a link and we can talk about their specialty or whatever they want to talk about. Anyway, you were listening to A Path to New You. I'm hoping to get, I'm hoping to do another episode next week. So trying to do an episode a week. It's been about 2 weeks since I did one. I'm going to try to do one every week from now on. Again, life gets in the way, events get in the way, and whatnot. So, anyway, you're listening to A Path to New You. Please like my Facebook page, A Path to New You. It's on Facebook. Please like and follow. Also, for my private practice, I have a New Beginnings Counseling LLC. Please like and follow that as well. And try to post stuff about self care and mental health and veterans issues on those Facebook pages. Anyway, you are listening to A Path to a New You. I hope you enjoyed this episode. Again, questions or anything like that, please reach out. And until next time, please be safe and please be well.